Welcome to this ability clinic. If you're new here, hi, I'm Dr. Van, a board-certified physician specializing in pain and function. When someone becomes paralyzed, their whole life changes. And for that person, their family, friends, and even their healthcare providers, it can be hard to talk about what they're going through. My guest tonight is a survivor of spinal cord injury who has actually made a career out of helping newly injured people through the toughest times of their recovery. She's a patient ambassador with the Triumph Foundation. She's also a podcaster, actress, and recipient of this year's Boundless Babe Award. Please welcome Brianna.
How do you normally introduce yourself to people who haven't met you before?
Hello, my name is Brianna Wheeler. I had a traumatic injury, so I was shot about 5 years ago. I also tell them that I'm a T12 through L5, which means I have function of my hands, but not of my legs. And I usually let them know that the beginning was very hard for me because I know that that's something people can relate to, especially in the beginning. I deal with a lot of newly injured people, so I feel like that beginning part needs to be really described well as well. Like going through the mental health of it, going through the trauma, going through the losing friends and the family and the things that people tell you, and religion. I had such a big relationship with God, and it was like very hard for me once I had my injury, right? All these things need to be brought into attention, but it's so hard to describe it all.
Brianna is very open about her personal struggles right after her injury.
In the beginning, I was very broken. I was very lost with this injury. I didn't meet anybody inside of a wheelchair for the first 2 years. And I see such a difference in women and in people in general when I really make my presence known in the very beginning. When I talk to newly injured people, I'm like, look, I know you don't know me, but this injury makes us family. Like,
Yeah.
I'm going to understand you like nobody else. Any questions you have, any resources you need. I do monthly check-ins and just like make sure they have what they need, because I know that it's very hard for people to reach out for help. They feel like it makes them weak. In actuality, it makes you strong to reach out, and to be vulnerable. That makes you strong. I found some of my closest friends through spinal cord injury through just that way, like reading their story, seeing maybe them saying, this is my first posting in a wheelchair, and just them needing that friend to lean on.
I asked Brianna about what are the most challenging and most rewarding parts of her job.
You have so many questions. The questions are, infinity, the amount that you don't know anything, and it's scary, and your family's all there. And, I say you have to roll into this room at these people's lowest points of their lives, and you have to bring some positivity. You have to bring some sort of light to them, and I kind of fell in love with that. I kind of fell in love with the fact that I could bring a little bit of light, that I could give a couple hours to go to these girls' house and teach them how to redo their makeup and how to get dressed up and how to love themselves again. And I can give advice to their family members, and I can see them grow and then be like, thank you. I don't know what I would have done in the beginning if you weren't there to guide me. Like, I appreciate you just being my friend. And the fact that I could offer that, it makes me feel like I have a purpose. And it makes me feel like my injury is worth it, and that God has put me exactly where I need to be.
That is very powerful. And kind of like you're saying, it's not just one person with the injury who's going through it. It's their whole network, their whole family. It's just a huge change from what anyone would expect would happen to them. And so to have someone as an example, such as yourself, who's been through it and can show them like there is a way forward, there is a way to live, and this is not sort of the end of everything you love in your life. That is amazing. I can just see your passion so clearly.
Yeah, because you don't know until you're shown. I know the way I felt in the beginning, so that's the only thing I can relate it to. I felt like without my legs, I'm useless now. What am I going to be? Who am I? I did not feel pretty anymore. I didn't want to get dressed up anymore. And so I know that initial shock, and that's all they have in their head, is how to do things walking. So I get to go in there and show them how to do things, show them, encourage them, it's not the end, you can still live your life inside of a chair. And yes, it's going to be hard. I'm not saying it's going to be easy,
We talked about how adjusting to a new spinal cord injury is extremely difficult, but sometimes all it takes is a slight shift in perspective to make it easier to move forward.
Another way to look at it, just throwing in little ways for like newly injured people to switch kind of the perception that they have in their mind, is losing a loved one is hard. when a loved one passes away. You have to realize that your own self that you created technically passed away. The person that you thought about and you had all these goals and dreams for, it's no longer there. And one moment it all goes blank and you feel so confused and you don't know who you are anymore. And everything that you did so routinely, like putting on your shoes and taking a shower and using the bathroom, all of a sudden you can't do anything anymore. And it's like a shock. It is a shock. It's a trauma. It's a trauma that you have to work through, and definitely very, very hard. And we're not taught right about it.
Thinking about your past non-injured or non-disabled self dying is kind of dark, but
you didn't die that day. So if you stop living, you did all that before for nothing. You created all those dreams and hopes for nothing. I cherish I love you, every smile, every, cup of coffee that you get now that you wouldn't have got, because the reality is people lost their lives today.
Yeah. That's a really good perspective. And I was going to say, like, even though you're alive and you're a survivor, thinking about your old self passing away, that's a really interesting perspective, because there is a huge grieving process. You have really lost what was your baseline, your normal. That's not your reality anymore. And grieving and just mental health and adjusting to any huge trauma doesn't get talked about enough. People close up, they want to disconnect and isolate, which it's so funny how common that is. And people feel so alone when really, like, everybody goes through that.
Definitely. Yeah. It's definitely a different way to look at it. When somebody that you love passes away, you get to go to a memorial, you all get to sit around and talk about, that person, the good memories that you had with them. You get a funeral, you get to have the candles up, and you get a whole grieving process. Instead, in this situation, you have everybody almost telling you, like, oh no, this person isn't dead, they're going to come back. Like, keep on just believing and they're going to come back. And how toxic would that be if it was like somebody who passed away? When you think about it in that way, it's so toxic to tell somebody that. Like, you just have hope, keep praying and they're going to come back. It's like, no, they're not going to come back. I need to accept life, and sitting here harboring it and being so sad about it, it's not going to help me keep on going. Of course it's sad. Of course I miss that person. Of course I need to grieve them, but I also need to keep living for them too. Yeah.
Oh, I love that.
Thank you. Yeah, it's hard, but that's what I love about this community, about like putting like this different thought inside of people's mind, because all you need is that little mind change to really change so much of your future and what you believe going on, and some people confuse my smiles and my positivity for me ignoring the bad stuff. And I have to be very clear that being positive doesn't mean you're happy all the time. It just means that you don't let the bad stuff destroy you. And I went through that. I let it destroy me for a long time, and I'm a better person and I love my life more when I don't allow it to do that. It's not to say bad things aren't going to happen. It's just that I acknowledge that good things are coming too.
Brianna's resilience and positivity made a typically uncomfortable topic actually pretty easy to talk about. Trauma is usually met with silence and avoidance, and Brianna acknowledges this with her own personal experiences. But her work is a great example of how survivors of trauma can find strength and healing by connecting with each other. If you want to better understand how to help people recover from an injury or trauma, hit that like button. If you want to see more conversations like this, subscribe to This Ability Clinic. Check the links in the description below to find out more about the Triumph Foundation, and you can listen to Brianna's podcast on the Live to Roll channel. Thanks for watching.